Hey guys, it's Dr. Matt again from Potomac Family and Sports Chiropractic Center. In today's video, what we're going to go over are a couple of exercises that we've been giving to a lot of patients coming in with neck pain. Specifically, this past week in particular, we've been getting a lot of kids coming in with localized neck pain, sometimes headaches. The popular phrase nowadays is text neck. So this is the protocol that we go over with them in terms of just some exercises they can do in the beginning of the day, middle of the day, end of the day, depending on what their pain feels like or how their symptoms are presenting. So I always like starting them off with just some light traction. This is the device that I use myself. I'll spend about 8 to 10 minutes in here, just letting it traction my head up and out instead of keeping the vertebrae down and compressed, which can happen a lot of times when we get into this posture here with the head in front of the shoulders, just stressing a lot of the musculature on the back part of the neck here. So I usually tell them to get some kind of device like this, just goes over the door handle or over the banister at your house. And again, I usually sit in there for about 8 to 10 minutes, but you can definitely go over that if you would like. It would just depend on what your symptoms are like, and then obviously if your provider thinks that it's a good idea, you can definitely get one of these. I got this on Amazon, so pretty easy. Another exercise that we do, you're going to take a band. This one's a loop here. You're going to place it around the outsides of your wrists. Palms are going to be up towards the ceiling. Then I'm going to come down onto my elbows. And what I'm going to do is press my elbows into the floor, pushing my chest away. I'm going to keep my chin tucked in, and I'm feeling like I'm trying to grow the top of my head out towards the wall in front of me. And then I'm going to rotate out against the resistance of the band. Hold that for 3 to 5 seconds. And then relax. Push the elbows in, push the chest away, keeping the chin tucked in, the head long. Rotate out into the band. Hold that for 3 to 5 seconds. And I may do that 8 to 10 times. So that helps to get some of my deep neck flexors activated, helps to get some of the musculature in the back of my shoulders to help pull my shoulders back in this position here instead of having them rounded. Another exercise that we do just to work on overall range of motion is a cervical CAR. So the CAR stands for controlled articular rotations. Because we don't really do a lot of range of motion for the neck when it comes to just day-to-day activities. I know a lot of people will do some passive stretching, and that's okay, just to work on the elasticity of the tissue, but you also have to stimulate the active component within the muscle so that it educates the nervous system how to actually control these new movements that you gain through ranges of motion. So the cervical CAR, again, if we remember, is we're going to maintain tension first and then control the rotation of that joint that we're trying to move down and around. And I'm just doing circles with my head and my neck there. I'm going all the way around, going clockwise one way, counterclockwise the other way. And I'm making note of any just areas of tightness or restriction as I do that. So sometimes, depending on how the patient's feeling, what their symptoms are like when they're doing that exercise, sometimes I'll have them take their finger. For me in particular, I always get like a little bit of a pinch higher up in my cervical spine. And now when I do my rotation, I'm going to rotate my neck around that new axis. Instead of trying to go past it, sometimes going past it or into the pain isn't always the best idea. So by creating that new axis, by using pressure from your finger, you're going around it and just gradually working on improving those ranges of motion. So that's the protocol that we use with a lot of our patients that come in with neck pain. Again, we've been getting a lot of teenagers with the text neck, and this is a protocol that we've been using with them that's been quite successful. So if you guys have any questions, feel free to ask, but I hope you enjoy. Bye.